Director of Events for Cal Matters. Welcome to our latest edition of Getting Through Coronavirus Explained. A little background on Cal Matters, who we are, what we do, and why we're doing these events. So Cal Matters is a nonprofit, nonpartisan newsroom in Sacramento, the state capital, and we're committed to explaining California policy and politics and how it affects you in your everyday lives. And right now, the coronavirus pandemic is affecting all of that. So we decided to put together a regular, timely series of events called Getting Through Coronavirus Explained, in which our team of Cal Matters reporters talk with California policymakers and professionals who are tasked with getting us through this pandemic. Our previous events, we've been doing these for about 3 weeks, have been focusing first on what senior citizens should do during the shutdown, what employees, both those who've been laid off or furloughed, as well as those who are still on the job but dealing with stress, what they should do when it comes to filing for unemployment or sick leave or family leave. We've done a couple of education-focused Q&As about how all our schools from kindergarten to colleges are transitioning to online education. And our latest episodes have been about how prepared our hospitals are for surging cases and what the state is doing to keep small businesses afloat during the pandemic and how they can open their doors when it ends. All these episodes live here on Cal Matters YouTube page and as audio podcast on our podcast hub, soundcloud.com/Cal Matters. Today, we're focusing on keeping your mental health in good condition and the best ways to do that while we're sheltering in place. This segment will probably be a little different than the others we've done because it will be a little less about policy matters and a little more about personal matters. And personally, on my part, I'm very interested in hearing the tips and strategies our speakers will offer on how to keep a positive outlook during this very topsy-turvy time. The idea for today's Q&A came from a great story that our health reporter Jocelyn Weiner wrote a couple of weeks ago titled How to Get Past the Coronavirus Without Losing Your Mental Health. And it lives on our website, calmatters.org. She's going to be our host today for the conversation, and she'll be talking with two mental health experts who she originally interviewed for that story, clinical psychologist Dr. Amy Offeld and psychiatrist Dr. Mark Levine. We want you to be part of this conversation as well. Please submit your questions by typing them into the chat box on the right-hand side of our YouTube screen. Jocelyn will add your questions to hers to ask Dr. Offeld and Dr. Levine. Before I turn it over to her, I want to let you know about the ways you can keep track of these events and all our timely news and coverage of statewide issues. You can sign up to receive our daily e-newsletter called What Matters, which comes out every morning. Subscribe to this YouTube channel and to our podcast hub at SoundCloud. And consider becoming a Cal Matters member or donor to help us keep doing our nonprofit, nonpartisan journalism on the issues that matter most to you that are being shaped here in California's capital. And I think I've covered everything. All the information needed to do everything that I just said is on our homepage, our website at calmatters.org. And with that, I'm going to turn the mic over to Jocelyn.
Hi, everyone. Many of us are experiencing some combination of stress, anxiety, depression, trauma, and grief as a result of the current pandemic. Recent polls showed double-digit increases in the numbers of people reporting worsening mental health as a result of the outbreak. Some of us are worried about pre-existing conditions and high-risk age brackets. Others are facing sudden economic distress. Some are feeling lonely and isolated. Others are feeling overwhelmed by togetherness. We're wondering how long this will go on and what the world will look like a few months from now. In short, things feel overwhelming. So what can we do to protect our mental health right now? Dr. Levine and Dr. Offeld, thank you both for being here. I'd love to start off by asking, what are you guys hearing from people about their biggest stressors right now? Is there anything that has surprised you? And what are your biggest concerns?
I'll start. This is Amy. I would say that some of the concerns, right now we have this trifecta of stress going on, right? The powerlessness that people are feeling, the uncertainty, this prolonged uncertainty that we thought was going to be a couple weeks, that's now morphed into month, and it has plans to last even longer, and this grief about the loss of normalcy we have. And I think all of those things combined are really triggering, a lot of different reactions for people. But those three main things, right? This powerlessness, feelings, uncertainty, and loss. And, and I think those are, really, of course, normal reactions. And I think the way that we're dealing with those and the way I'm trying to help people deal with those has to do with kind of even the steps of grief that we've gone through in the past, right? That we use this model of, okay, at first we just deny the whole thing is happening. Right? This is not happening. And a lot of our behaviors, focused on that. And now people, I think it's in our face enough that now people are seeing this is real. And now we have to kind of figure out, okay, we're bargaining with it. How much longer? Okay, I can do it for 2 weeks. Okay, I can do it for 2 months in terms of sheltering in and my life looking a lot different. But I think there's also part of, the anger and sadness that comes in. And what I think us as mental health professionals are trying to help people, as well as help ourselves, move into the more acceptance of this and what that looks like.
Thanks.
Mm-hmm.
I think that's a great, all-encompassing answer. I would add a couple of things. I think in general, it hasn't hit us all yet. Obviously, we don't know how difficult this is going to be. I think that there's been a lot of discussion about what might be positive about this. And I think that may very well be true, that I think our whole society is going to be reevaluating what's important to us. However, when you've lost your job and you don't know how to pay your rent and you're worried about whether you're going to infect your children or your parents, those kind of thoughts aren't particularly useful. So I think in general, what people are thinking about is what's going to be useful here. And that's why there's so much interest. Are there simple tools? I mean, not everybody can spend the time or afford to see a therapist. First of all, a lot of people may lose their insurance. A lot of people don't have insurance. So that I think that's going to be a particular challenge. And one of the great things is that there are simple things that people can do to feel better, but that has an edge to it because often simple tools don't solve huge problems. And so I think part of our discussion today is going to be what are the simple things that can easily be tried, and what happens when those things don't work? Are there other kinds of approaches? So thank you for your answer.
Great. So that points to my next question, which is just, how are you using this kind of in as concrete a terms as possible? Like, what are some of the tools that you're using or that you're offering to loved ones to use?
Mm-hmm. Mm-hmm. Okay. Do you want?
Go ahead. I think, Amy, by the nature of what you do, you've got a lot to say about tools.
Okay. Well, I think, the tools, one is letting people, this time is really giving us a chance to focus on what's essential and what's non-essential. Besides our jobs, what's essential, what's non-essential. And I think that this can either be a time where the amount of time we're spending at home with people, if we live with others, family or other roommates or loved ones, can either be a time of great bonding, or it can highlight the differences and the different ways of coping. In addition, even though we may really love one another, we may have different ways of coping with this. And so I think part of it is just acknowledging, oh, you know what, my partner might deal with uncertainty a way different way than I deal with uncertainty. And so we have to come to, both acknowledge that, but then also figure out a way to, okay, I need a little more certainty. So building routine might be something that's really important for me, whereas for someone else it might not be as much. And it might be like throw out the routine because there is no normal, so why even have one, right? But trying to figure out, how this is affecting all of us, but then also noticing those differences and being able to, create maybe some new routines. I think the social cohesion yes, we've called this social distancing. It's really not. It's really physical distancing. We really do need social cohesion. To me, is going to be, the elixir of how we get through this. And so that's the other piece, is how do you, make sure that you still have those people that you reach out to, those groups that you're part of. I mean, there's so many different ways, thank goodness for technology as we're doing this show, but in general, I mean, 12-step programs, people who are in recovery for substance abuse. There are Zoom meetings happening left and right for people. There are ways that, grandparents, even if they're separated from their adult children and grandchildren, that they can still have contact through, technology and phone calls. There's book clubs happening. There's college groups happening. There's people that are planning for fundraisers and things to do after this time passes to help those communities that have been the most impacted. So I think, those are some ideas.
Did you want to add anything, Dr.?
Yeah. My main interest, both clinically and in research, has been mindfulness. And even though I'm a psychiatrist and I've spent my career helping people by giving them medications that are helpful and often critical, my main focus in research has been in the area of mindfulness. And so one of the big questions is, what does mindfulness have to offer in this time of crisis? And why would mindfulness, which is just a training in awareness, be helpful? So what I wanted to emphasize is much of the tools that you've been describing and much of the values that are important are really enhanced by awareness. And so the appeal to me of mindfulness training is we offer a simple 4 to 5 week training that gives people these awareness tools that I think really enhances connection with other people, the ability to listen, to be with people. It's sort of an irony in a way that often the very people we love the most, that we're most connected to, now we're with 24 hours a day. And so in a sense, there's this tremendous opportunity to be close. And also, as you mentioned, you don't have to have physical contact to be intimate with someone. Of course, nothing replaces that, but to be together over Zoom offers the opportunity for intimacy. But many of us have not been trained in how to do that. So for instance, something as simple as listening. I mean, how often, myself included, have we been in a situation where we've been working hard all day, we have a million things going on, we come home and our kids or our spouse wants to talk to us for a few minutes. And maybe we listen to them, maybe we don't. But we really miss an opportunity to connect because we're often not trained how to connect and listen. I mean, therapists receive years and years of training about how to listen to somebody. And so there's just tremendous power. So the irony of what's happening now is we're all kind of stuck at home, and it's not a fabulous experience because we haven't been trained for this. Let me put it this way. And so part of mindfulness training is how to listen to people, how to connect. I mean, there's nothing that we want more than to be heard by another person. And yet it's actually a trainable skill. And then, of course, we feel frustrated and guilty because we're aware we're not connecting and listening, even though we're having this, quote, ideal opportunity. So the last thing I would add is there is a training that's fairly simple that does emphasize skills, which then allow us to utilize these, quote, forced opportunities.
And I think we're going to put a link to that on our website, right? You were sharing a link for that.
Yeah, we actually have we've made this training available for free. It's a protocol that was developed in conjunction with researchers from Harvard University. It's a very simple protocol. We offer it over the internet, 75 minutes. We've been offering this for 5 years. Insurance covers it, but I felt that these simple awareness skills would be so useful that we're offering it to anybody for free. We're not charging anybody for it. And it's this is a live class taught by senior mindfulness teachers that's live over the internet, and the link is on the web.
Okay, it sounds like it just was posted. Great. Well, so we've heard from a number of readers, and I think depending on who you are and what your situation is, you're obviously experiencing this very differently. And so what I wanted to do is just kind of go through some different scenarios that people have posed. I'm going to start with my own because I think a lot of people are in this situation. I have 2 young kids at home. My husband and I are both trying to work remotely while caring for them. It's stressful. We're working late at night. We don't have time for self-care. And I'm curious, for people like us, if you have suggestions.
One, I would say that this is something I'm hearing a lot about, which is, the lovely part of all of this with more family time and more kind of FaceTime with kids. But there's also the reality of more time together and more FaceTime with kids, and trying to balance the work if you're fortunate enough to be able to work from home, to be able to balance all that. And I think the first part of that is just a great kind of family meeting, between you and your husband about, how negotiating what does this new normal look like for now, and in terms of role continuity, what structure, how do you want to do this? Maybe you tag team, one of you, is just off work doing kid stuff and separate from where you're working in short bits of time, and you guys switch or manage that, compromise with that. Hopefully your employers and I know this is funny because you're working right now,
and they're being great.
I think the flexibility that everybody needs to have, right? Because there's as routine as possible, but with some degree of flexibility, because it's not going to be perfect, right? So it's also going to be a little bit different how we're going to work in this climate, and how you and your husband are going to manage with the kids, And I think we just need to, the bar cannot be set so high. I've heard a lot about productivity during this time and being at home. How productive people want their kids to be, people want to be. And there is something to being productive, because we want to feel some sense of efficacy around doing things, right? And it makes us feel good to do things and accomplish things. But at the same time, we also need to, the bar is set lower. We're not going to get all the stuff done that we want. And there's also value in having your brain shut off from being task driven. Which is, the same state that our brain's in when we're dreaming. That also helps kind of, us take our anxiety down, relax, and and help us emotionally process what all this change that we're going through.
Did you want to add anything?
Yeah. I think everything that Amy just said was really lovely and very useful. I would add sort of 2 perspectives to this. One is that in the middle of all this, it's really useful to be self-compassionate. This is hard in many, many ways. It's hard in big ways, but it's also hard in little ways. I mean, my daughter has a 4-year-old and a 2-year-old, and we've done social distancing with them, which has been very hard. But just watching her with the day-to-day management, just how to keep the 2 of them safe while she's trying to cook them dinner. And her husband is, actually works in them as a medical provider. And so he's gone very long hours in the middle of this crisis. And sometimes we just really need to know we're doing the best we can with what we have, because there's no gain to being harsh with ourselves when we don't get this right. In that moment, which then leads to sort of the second thing. In addition to self-compassion, I find it's really useful to periodically ask myself, well, what's important here, right? And so there was this part that I really needed for the refrigerator. And if our refrigerator goes out, on top of everything else, and you can't even get a repairman to do this. So we're online trying to figure out how to actually repair this machine. And my wife ordered the wrong part. So I got this whole thing going on, and she ordered the wrong part. And I opened up, I realized, and I started to feel really angry and frustrated. And I could feel myself sort of starting to yell, "How could you get the wrong part?" And it helped for me to just pause a moment and ask, well, what's actually important here? I mean, what do I care about, the refrigerator or my wife in our relationship? And there are many, many moments like this that we have. So I find when we start to feel upset, usually there's something going on with someone else or with ourselves. We make a mistake. It's useful to just pause and say, well, what's really important here? I'm in this terrible situation. I'm doing the best that I can. And of course, I'm going to lose it. Of course, I'm going to do something wrong. But I can forgive myself. I can really take care of myself, and I can be kind to the other person.
Great. Well, thank you guys. That's personally very helpful. And then I wanted to sort of go from that to a question about children and adolescent mental health. We've definitely seen some reports that adolescents especially can really be struggling right now. And we got a question from Deborah from Los Angeles. She asked what teachers can do to best help their students and families deal with the added stress of having to take online classes without their classmates, daily instruction, and face-to-face support. And I'm sure, in addition to advice for teachers, advice for parents or other caregivers would be great too.
Mm-hmm. Yeah, I think the first part of this, and I used to be a teacher, and I also have lots of friends who are still in education, and then have tons of friends who have younger kids at home, and I have teenagers at home who are, in a variety of schools are doing a variety of things in terms of how much distance learning that is happening. I would say that this COVID-19 is hitting teenagers and adolescents, I think, the hardest. Maybe adults, we feel like it's hardest for us, but honestly, just experiencing this at home with my almost 15-year-old and 17-year-old, wow, it's tough. We were at the grocery store. Two of us went to the grocery store, and my 17-year-old was dying to get out. So 2 weeks ago, we went, and I said, okay, you can go. We're going in to get what we want and come out. And one of her friends happened to be at the grocery store. I mean, I felt like I had to be, in front of them screaming, no, you're not allowed to get close to each other, just because it's palpable how much they want to see each other and how much they want to be close in that proximity. And it's funny, I think it's ironic because as teens, they've gotten this, people have this idea that the technology, they don't really care about seeing each other. Well, I can tell you this whole thing, COVID-19, that's completely not true. They are suffering because they're not able to see each other. And I also think, depending on what's going on at home, it can exacerbate a teen's sense of loneliness or whatever, or trauma or whatever they're struggling with as well. Because they're isolated and they don't have their peer support network, not in the same way they did when they went to school, and also that identity about going to school. And for those who like school and have a positive, positive self identity of themselves at school, they're missing that. So in terms of teachers, what teachers can do, and also parents for teens is one, I think the teachers and parents to acknowledge each other and acknowledge this is not easy, right? And the same expectation for kids to be in school for 7 hours a day is not going to be what they're doing distance learning. I think humanizing it and for the teachers to be able to ask questions of the kids before their lessons, but just to say, hey, how's this going? And maybe make work more project-based than the traditional, what they would be doing in school. Because project-based, what are they curious about? How can they use COVID-19 in this time to create something new or do something different? My son, who's 15, is an avid soccer player. He's excellent at it. His teammates are amazing. They are missing so much seeing one another. And my son is on a team with amazing kids, many of who will be first-generation college students. And they're all in ninth grade. And so my son is interested in making a nonprofit to help get first generation kids into Division III colleges. So this is the perfect time. He's contacted a lawyer about what it takes to set that up. He's building a website, right? This is kind of project-based learning, I think, at its best, not just for the sake of just doing some project, but something that really matters to him. So I'm using those personal examples from my life, but I just encourage educators as well as parents to think of this educating time as different than it's not going to be a replacement for what school is, but actually maybe it's worth even more this time because there's so much they're learning from their families as well about historically how have families, cultures, through religion, how have families been able to get through difficult times in the past? And is there writing that can be done about that, right? To foster that sense of, historical resiliency for a family, and is there a way that can connect to their school work that they're doing and reading, writing, math, science, all of that. So I could go on because I had education as part of my past, but I certainly would just encourage those kind of dialogues to be happening with kids. And because if you're not, then you're really negating what they're going through. And this is 90% of what they're focused on, is how much they're missing out on, right? All the loss that kids have had, from graduation ceremonies to trips they were going to go with friends, college visits that they were going to have, athletic events, tournaments, it goes on and on. Now, those aren't capital L losses, but those still make a big difference in a teenager's life. And the last thing, and I'm going to stop, but the last thing is that this whole opportunity has allowed us to, this COVID-19 has allowed us to have the opportunity to really walk in other people's shoes and broaden our perspectives, from Asian Americans who are getting, different racist things done, and said to them, to, our kids and what they're going through, to older people or people with pre-existing conditions that are so, are feeling even more vulnerable, right? People who already were isolated and now feel that times 10. It's really allowed, I think, all of us to be able to look at that and hopefully be part of a solution if we have more ability to have power and privilege in that way. So I'm sorry I kept going on, but sorry.
And that was great. And I appreciate that you can speak to it from both perspectives, both as a teacher and a parent. And of course, we all remember what it was like to be a teenager. What I wanted to add about this is that I think that a huge challenge for teachers, and I like to teach, but I'm not a teacher. But I think a huge challenge is we've taken your work away from you. This thing that's meaningful. In many ways, as physicians, those of us that are actually helping with the crisis, it's a little easier because we can focus on what we're contributing. And all of a sudden, your life's work that's so important is just being put on a huge pause. At the same time, I think that teachers do have contact with their students through the web in different forms. And I think that there's a new role that's being formed here of what it means to be a teacher and what you can do. And so I would encourage parents and teachers to be thinking about this from this perspective of what is my role here? Because it's obviously really important. And one of the first things as you were talking that came to mind to me was that safety, having our young people feel safe in an environment where there's danger is really important. And they're going to look to us to how are we dealing with this? How overwhelmed are we? What's our kind of equanimity, or what do we value and how do we manifest our values? And so our kids, even our teenagers, might not look like it, but they're looking to us to see how are we responding in this very, very uncertain time. And safety is a feeling that comes from the inside. And again, I would also add that for teachers, I think self-compassion and really taking care of themselves is important, because if we don't take care of ourselves, we won't feel safe, and then we don't have anything else to offer. And then the final is teachers have the opportunity, as of course parents do, to focus some on what's important here. What are the values? What do we want to cultivate? And by the way, if your son has some free time, I've got some fabulous projects I need some help with. So we'll connect later.
Great. Well, so now let's go to another very common situation. A couple of people have written in about this. One reader from Los Angeles wrote, "Please ask the speakers to focus not just on families, but also on those of us who are single with no partner and no children, isolating entirely alone. It's extremely frustrating that people focus only on how hard this is for families without acknowledging or addressing what totally isolated people can do beyond Zoom calls and exercise. These things aren't enough. How are we supposed to manage without being able to get a simple hug or be physically near anyone? What can we do when video chats and writing letters isn't enough? What can we do to not feel left out and even more alone?"
Yeah, I would say one way is get yourself a coach or a psychologist or a therapist or someone who can be, who can give you permission to share how hard it is, right? Because that I would agree that a lot of focus that I've seen in media and writing has to do with families and children. And I imagine people feeling, especially when you're used to living by yourself, but now it's compounded by this. Absolutely, you deserve and should receive the support. And there's lots of us that want to, help during the COVID crisis, who want to be there. And whether it's video conferencing, telephone, just to check in, even somehow being able to even email through a secure way back and forth can be really helpful. I think this feeling like what you are doing, and I think this is something everyone could benefit from, but whatever choice you're making about you staying home and social distancing is also about this collective spirit and collective thing that all of us together are doing. So if that can make you feel better about, okay, I'm part of this bigger group, this bigger cause, right? And then I think the other thing is that, that self-care that one needs, which is having things of comfort, right? Whether that is, a reminder, different friend that is someone you can really talk to, or a group of girlfriends that you check in with once a week and you say, we're checking in no matter if we feel crappy or not. We're going to have a call with each other. If you're going to, if you need comfort, like, soft blankets, physically comforting things, right? That we would use, doing self-care type rituals for yourself, balancing it with, with the running and exercising, because we know that also helps us. And I think whatever habits you create today for yourself, it's not just for today. It's not just for the quarantine. It's habits that can, put you on a different trajectory when all this thing is done, when all of this is over. So that again, and Mark can speak more to the mindfulness and meditation aspect, but whether that is taking walks, whether that is just taking a mindfulness walk and noticing nature near your home, whether that is making a meal. I have a friend who is learning how to make pumpernickel bread during this time, and he's mastering that and really putting some of his daily energy into that as well. So these kind of things that bring you comfort, looking through photo albums, that you of times past that bring you a lot of joy when you're looking at them. So those would be some suggestions.
I don't have anything to add to the list. I think that was a pretty complete list of useful things. And I think it is hard to be alone. And when you're with a group of people, a family or another partner, you may be having a lot of difficult moments, but you have somebody to be with. And we are social beings. We thrive on our connection. And of course, everyone does it in different ways. Some people live alone, or they're single, or, I don't know what the caller's situation was. But, for instance, my son was single for years and years and years and wasn't interested in kind of getting married, maybe as fast as my wife and I would have liked to him. But even though he lived alone, he was incredibly social, and it was a very important part of his life. And this is being taken away from single people who are literally helping out society at their own expense. I would add one small thing to consider, though. When I look at the people who are getting the most meaning out of this terrible situation, they're pretty much people who in some way are helping other people. And that covers a lot of territory. I mean, obviously the most dramatic are the people who are working in medical facilities, whether they're physicians or janitors or electricians, right? Those people are more obvious, but there's all the other people, like the people in the grocery stores, who are putting their lives at risk so that we can eat, or the parents who are taking care of kids or relatives, or taking care of an older parent. I mean, there are many ways of contributing. What I don't know yet, because this has not emerged as much, but I think we will start to see more opportunities as this extends, more opportunities on the web for people to contribute and help. Because my own personal experience is that we are happiest, we have the most meaning when we are contributing. And I think that might be an avenue for the person who is asking this question, who speaks for many, many people. How when we're alone, cut off, how might we access the web to help other people? And I'm sure there will be opportunities.
Just to follow up, because a few different readers have asked about that specific question. Do you have any specific ideas, or have you heard of any specific ideas, especially for seniors who do feel like they can't be out in the community, but really do want to be helping and contributing and volunteering? Have you heard of anything?
Well, this is go ahead, Amy.
No, go ahead.
No, I haven't heard of something, but go ahead.
Well, the way that I have heard about this, and I think, even this past weekend with the idea that everyone should be wearing masks when they go out. I mean, I have so many people across the country I know who are sewing for the first time. There's all these patterns that have been released, and everybody is trying their best to make them, and distribute them to those in their community. I've heard of older people, grandparents, or just older people who have a talent in something or an expertise, whether that's sewing, singing, piano playing, playing a card game, and getting on a chat with a younger person, teaching them that, right? So there's some feeling like they're doing that. I know that at the local clinic near where I live, the community made notes and things that could go on kind of like popsicle sticks, like thank yous to all the medical professionals, and put them in the ground outside the walkway up to the medical clinic. So I think there are many different ways that we can contribute. It's more just trying to find which one resonates with you and how to use your creativity to do that. But I would agree with Mark. I think anytime we contribute beyond ourselves, it gives us a sense of meaning and purpose and makes us feel better.
We are. I mean, we are actually wired up neurologically to connect and be kind to each other. I mean, there are neurologic pathways that you can see on CT scans when people are kind to each other that light up in both parties. What I was going to add to what you were saying is I was thinking here, we're living in California, kind of the birthplace of technologic innovation. And this is an idea that is worth, for somebody who wants to go out and create something new, there ought to be like a website for helping people in this situation of social distancing. Maybe there is a place, but there ought to be a place where you could go on and say, here's something I'm good at. I want to connect with other people who are good at it, and I want to help in some way. And that website would connect people together. And, it's kind of like crowdsourcing kindness.
Good name. Well, I wanted to move on to another group of people, which unfortunately is growing, is the number of people who are really facing a lot of economic distress right now. And you had mentioned that there are people losing their health insurance. Someone from Jennifer from Richmond asked, like, how does this pertain to self-employed musicians who have lost all their income? Do you guys have tips for people who are struggling to pay their bills or finding themselves uninsured? And then, of course, there's a large population that was already homeless or near homeless and struggling even before this. So obviously, like you mentioned, like these tips are while helpful, might be challenging given their underlying circumstances.
Mm-hmm. Yeah, I think that's a real concern of many in terms of losing their income, either temporarily or for the foreseeable future, which is really difficult, and the stress that involves. What I have recommended to some of the folks that I see that have been impacted economically is, try not to predict future. Right? Try not to go there. You have to deal with what is in front of you right now. But, I think when you interviewed me for the article, Jocelyn, I said, our brains are also wired to kind of think forward and worst case scenario, right? And 90% of the time, it's not going to be worst case scenario, and best case, 90% it's not going to be best case either. It's going to land somewhere in between. And so getting people to just try to, kind of rein in their anxiety about money and financial worries and look at what's in front of them and, chunk it down, right? Take it one day at a time, one part of the day at a time. And, you are going to do what's best for your family, for yourself. In terms of, the benefit of right now is the fact that we don't have a lot of extra ways to spend money right now, just our main expenses. And so some living simply, this is a great test run for that right now. And, just encouraging people to do that. And then think about, since there's time, a lot of people who are unemployed right now have, what you do have an abundance of is time. So for this time, can you think creatively? Is there something that you would have liked to have studied or done or, looked into for a different career or for something, an adjunct part of, of what you're already doing, and maybe exploring that a little bit to give yourself options and open that up. But I would just hesitate towards predicting future, because most often we're going to be wrong about what that looks like. And so staying present and just dealing with what you can in the moment, I think, is really important. I know in terms of homeless and community, I have already heard of and seen things happening in the Sacramento community, in the Midtown community. That's where my office is. And I had heard from a colleague about some chefs getting together for restaurants that have closed and or have, scaled down, and they had to let go of so many different people, of their workers, but coming together for the community to try to feed people. So I know that that's happening. I know that schools are doing that as well to make sure kids are still getting fed, their breakfast and lunches. So, there's a community effort too that I think is going to happen as an outgrowth of this as well, and hopefully no one is going to get slip through the cracks in our community, especially if all of us are on board to help with that.
That was a very, as usual, very comprehensive answer. I would add two things. One is just a practical thing. The small business loans that the government just released, over $1 trillion, I think it is, are actually available to more people that realize it. So there, for instance, this came from someone who's a musician who maybe gives music lessons. That people don't realize that if you are a single person in your quote company, in other words, you're not employed by somebody. So the loans that are being made available, and they're not insignificant, I mean, an enormous amount of funds are being made to big businesses, also small businesses. And the idea is that the small businesses will take that money, which is a forgivable loan, so it's coming a gift from the government, and they're distributing it to their employees by maintaining their payroll. So a restaurant, for instance, that has gone out of business will take this money and will keep their employees who are not working on payroll. Well, there are many single businesses, the 1099s, what they're called. They're not aware that they really are a business. So if you're a music teacher and all you do is teach music lessons, and that's how you support yourself, you can apply for these loans. You can get the same loan, and you will maintain your monthly average income for 2.5 months. And I don't think most people understand this. And so this money is available, and I'm not a good person obviously for financial advice, but your local bank will be able to help you with this. The other thing that I was going to add, at the risk of getting a little political here, is there are many issues that this infection, this pandemic, is highlighting. And Amy, you named a few. So like the homeless are particularly at risk here. Immigrants, who many of whom have lived here for 30 years, are at extreme risk. They don't have the same access to anything. People who live at the poverty level. You've all heard in the news, I'm sure, that certain populations, minority populations, are at much higher risk for dying because they have more medical problems because they're not getting good medical care. So access to medical care. And then on top of it, a lot of healthy people are losing their medical insurance. They're getting some employment assistance, but millions of people are going to lose their medical insurance. And then finally, we're now seeing what happens to people when their education is disrupted and the potential of technology to do that. So to me, all these things say that we are going to have an opportunity or the necessity for tremendous, I think, political change, because these are needs that didn't happen with the virus. They were there before and causing terrible suffering. And it's just now we see it even more dramatically. And my hope is that, again, there'll be a reevaluation of what's important and maybe to align our society with what's important. It's hard to think about that when we're individually suffering, but it's part of making this shift from kind of suffering to contribution or coping to contribution.
Okay. Great. Thank you so much, both of you. It sounds like at Tuesday's Q&A, which is also on the website, covered some of the financial things you were mentioning. So people who want to learn more could go to that. And I wanted to talk a bit about people who are not able to shelter at home because they're health workers or grocery workers, or they're delivering the mail or all the packages that everyone else is getting so that they can stay at home. A couple of people wrote in asking about their anxiety around that or around loved ones going out. Solomon of Benicia said, "How can I deal with my concern for my wife's health as she goes off to work every day as a mandatory worker, possibly being exposed to COVID-19? How can we manage the anxiety that accumulates every day she goes to work?" For those people who aren't staying home, or for their loved ones, what do you suggest?
Well, I would suggest having, some agreement with the person who's going out and the people at home about what are the precautions that person going out is going to take, right? We know enough now, if you listen to, Anthony Fauci and all the others, that we're hearing, we know what to do, right? We know how to keep ourselves safer, right? And so as long as, the person who's going out is going to agree to that, then, and then there's a certain ritual for coming back into the home, right? Whatever that looks like in terms of changing clothes and washing hands or showering or whatever it is, then I think, that's the best that you can do. And probably the reason the person is out there doing the essential work is because that work is essential and because they feel like they're contributing to helping, whether it's, the medical staff that are helping at hospitals to help people who are sick, whether it's people delivering and are, doing that because that's the only way that some people are able to get food and want to contribute that way, as well as keep their job and make money. Whatever it is that this is what people are doing. And so to have some kind of, while I don't think you'll be able to get rid of all of the anxiety until this is passed, I think being able to lessen it by what are these habits that we're going to have around, protection as much as possible.
Did you want to add?
Yeah, I really appreciate the question, and if whoever wrote that speaks for many people, I'm sure who are listening, and I'm personally very grateful for that. We say to our servicemen, thank you for your service. And I think that perhaps that's the best that all of us can do right now. And it's a huge sacrifice. It's the sacrifice on the part of the health workers that are going out there and have to worry. Excuse me, it's a little close to home, but really have to worry about not only their own safety, but the safety of their families. And while it's true that, yes, they're doing all these things, you listen to the news, people are taking showers at work and then they're stripping down. And we had a colleague who has a routine. They take all their clothes off in the garage and then they go right to the shower and they shower down. And they do all that and there's that risk. So I don't know what else to say other than thank you to both the families and the people who do that.
Thank you. Well, we have a few more minutes. I did want to see if I could get you guys to give a few thoughts to the person who wrote asking about substance abuse, because I know that is an area, especially for people who maybe are going to meetings every day or a couple times a week. This woman, Susan of Mill Valley, asked, what are your tips for staying connected and overcoming loneliness or this tendency to self-numb with drinking or drugs during the mandatory stay-home provisions? So we only have a few minutes, so if you keep your answers somewhat brief, then I might be able to squeeze in one more question, but we'll see.
Yeah, this has been something that I've definitely, been talking to people about, because there are people that had, pre-existing addiction, right? And now they're at home and either they have more access or less access to that addiction. What I just keep reinforcing for them is, that whatever groove you lay down right now, whatever you can do right now and whatever steps you can do, getting, attending Zoom meetings, if you're a 12-step program helps you, talking to your sponsor, working your steps, this is the trajectory that can really change once freedom is lifted, once we have freedom back. Because for some it's easier because they don't have access to whatever that addiction is because they're at home. Others, obviously, alcohol, and some other drugs are available at home, and there has been an increase of that, I think in a lot of nationwide surveys. So it's also, how do you keep accessing that support and using this time as a way to really work your program so that when freedoms lift, you're in a better position for yourself.
Yeah, I totally agree. Go to your meetings.
The last question is, I guess I'm curious for people where sometimes they're just going to need more. They're going to need professional help, or they're going to need to do something because I'm wondering what you suggest, like how do people know when that is, and if there are any resources you can think of to share. And we're also listing a bunch of resources on our website.
Well, so what I had said before, I'm going to reinforce again, is this is a real, I think, a real opportunity, because we have literally a collective discussion on mental health right now, worldwide, that we haven't had in decades, I don't think. So in terms of normalizing this and it being okay and normal to have mental health concerns about this is super, super important. And I think, hopefully people will feel able to reach out to people. There are, psychologists, therapists, as well as both soft hotline and other crisis hotlines, kind of a warm hotline, I think they're calling them, and crisis hotlines that are available when you just need to talk in the moment, for all ages, for adolescents, for elderly, as well as just the general populace. I would say access them. I know I gave you a bunch of resources, so they will be on your site for sure. There's the psychologist locator through the California Psychological Association that you can access going to cpapsych.com. or I think it's .com or .org. I'm not sure. It's on your website. And then also Psychology Today, is another listing. But this is a time we want to be there. We want to be available for people. And I know lots of clinicians that even if someone's insurance is in jeopardy, even if someone, doesn't have insurance, that we want to be able to be available as well. So I would say that this, I like that hopefully the stigma is decreasing because of this, collective talk about people's mental health needs. I think if you find yourself, with all of the kind of symptoms of either depression or anxiety, and it just feels too much, you feel overwhelmed, and you're not acting or behaving in the way that you normally would, or you're turning to things to numb yourself, that is absolutely the time to reach out. And we are here waiting for you. And luckily, for any policymakers, or people out there, luckily some of the restrictions on telemedicine, telehealth have been lifted because of Medicare, the federal government lifting those and allowing us to have video conferences with our patients who are on Medicare, and the other insurance companies have followed. And I'm hopeful that this, loosening up some of those restrictions are super important for times like this, but that we also won't go backward, because it's we want to make it as easy as possible for people to access services, and we are here for that as well, and we're waiting and wanting that. So that's what I would say.
Thank you.
Yeah, I would wholeheartedly agree with all that. It's better to get help earlier than later. Small problems are much easier to solve, and also the best that we can feel allows us to bring more resources emotionally and intellectually to these very, very real problems we have. So, yeah, there's a lot of help available.
And one last thing, Jocelyn, is just I don't see this ending. We're partly in crisis right now, given our shelter in and all that's going on, but post COVID-19, there is going to be a lot of need, and I think a lot of help needed for people, either people who've been on the front lines and now have, some degree of PTSD for what they've seen and done and what they've been part of, and either that feeling of not being able to have helped people or saved people, and all that they kind of experienced. But there's also for what's gone on during people's time at home, and and how you reintegrate into your regular life, and the fear that's still there. So, I would say that it's really necessary for people to know what's going on with their mental health, and to really be able to pay attention and get the help that they need.
Well, thank you guys both so much for your generosity with your time and your insights. I found it very helpful, and hopefully a lot of our listeners did too. And thanks to also to everyone who did send questions. They were they prompted a great discussion. So thanks.
Thank you.
Thank you.
And I wanted to just chime in and say thank you, Jocelyn. Thanks again to you, Dr. Offeld and Dr. Levine, for joining us for a very timely and very relevant discussion. And just a few things to sign off, to mention before we sign off. If you do have more questions for our two guests, and you sent some great ones during the discussion, please email them to us at info@calmatters.org, and we'll pass them along to the doctors. If you missed any of this discussion, if you came in late, you can watch it again. It's going to be recorded and living here live on the YouTube page. We also will have an audio podcast that we're creating a little later and putting on our podcast hub. So it's going to be at soundcloud.com/CalMatters. And it's also going to be living both audio and video at calmatters.org. For all our coverage about the coronavirus outbreak in California, you can subscribe to our newsletters. There's two places to do that, calmatters.org/subscribe and also calmatters.org/coronavirus. And again, if you're able to support our journalism at this time, please make a donation via our homepage. All this information you can get at calmatters.org. We do have another Getting Through Coronavirus Explained event that ties into this one. It is scheduled for Tuesday, April 14th, this Tuesday, April 14th at 1 p.m. We'll be talking about financial assistance and safety nets that are being rolled out statewide during the pandemic and how people in need can access them, as well as how people who want to help those in need can do so. In the meantime, please stay healthy, stay strong, stay safe. Thank you again for joining us, and we'll see you here next time. Thank you. In the meantime, please stay healthy, stay strong, stay safe. Thank you again for joining us, and we'll see you here next time. Thank you.